We're going to begin this hour with today's Health Watch. New research on attention deficit hyperactivity disorder, ADHD. It affects about 15.5 million adults, but it could be much more common than we realize. A new survey finds about a quarter of American adults suspect they have ADHD undiagnosed, but only about 13% have gone on to talk to their doctors about it. Mental health experts worry that self-diagnosis can lead to the wrong treatment. CBS News medical contributor Dr. Céline Gounder joins us now. She's the editor-at-large for public health at KFF. Dr. Gounder, good morning to you. So don't self-diagnose, probably good advice overall.
For most things.
For all things.
Yes.
But what is ADHD, and is there still stigma around it?
So ADHD, attention deficit hyperactivity disorder, which is characterized by issues with inattention, restlessness, hyperactivity is in the name, and impulsivity. And the reason there's a lot of stigma around this is we tend, as a society in general, to blame the symptoms of many medical issues, from obesity to addiction, on character flaws, and are missing the point that this is actually a real medical condition.
So if you believe you have it undiagnosed, I mean, you should go talk to your doctor, right?
You absolutely should, because the symptoms of ADHD can be more subtle in an adult. There's a lot of overlap with other mental health as well as other medical conditions. And how you treat it may be different depending on what mix of symptoms, what other overlapping syndromes you might have.
I always think of it as something that children are dealing with. So do you have it as a child and it continues through an adult, or do you sometimes just develop it as an adult?
Good question.
That's a great question.
Yeah, it's probably more likely the former, in that it went under the radar. But there are some people who do seem to develop some of these symptoms later in life. But, you know, I think, again, with adults, we're more mature. We're better able to mask some of the symptoms and cope with some of the symptoms. And so it may be not as obvious in an adult.
So I heard you give the symptoms, but how do you know if you have it? How do you know that I'm just not a high-strung personality and don't have ADHD?
Well, some of the things that we're looking for, so inattention, you might not be finishing projects, you might have difficulty with organizational skills, time management, maybe you're super fidgety, you interrupt other people, you're not waiting your turn. Those are some of the kinds of behaviors that we see, but again, there's a lot of overlap with other things, so you really do need somebody who knows how to diagnose this to make that diagnosis.
Okay, so if you're not on medication, how do you manage it?
So there's something called CBT, cognitive behavioral therapy, which is really teaching you how thoughts, feelings, and behaviors interact, and how to, in a sense, override what might be your initial impulse in a certain situation.
Is medication the best way to go, though, in this?
For
ADHD?
First line, we generally recommend a combination of CBT, so the cognitive behavioral therapy, plus a medication.
Gotcha.
So those are medications like Adderall, Vyvanse, Ritalin, Concerta. Those are stimulants. And then there are also some medications that are not stimulants. They just take a little longer to kick in.
Okay.
So things like Concerta or the antidepressant Wellbutrin.
Gotcha.
All right. Thank you, Dr. Céline. Always good to have you here.